Well, good afternoon. We're here providing our afternoon update on the coronavirus here in Kentucky. The most important thing that we can take away every single day is that while we are working to be prepared, that everybody should remain calm, that we are ready for this, that our local health departments are ready for this, that the state is ready for this, and we will get through this. To every Kentuckian worried out there, yes, we're going to have to take some steps that disrupt our daily lives, but we are going to get through this. We're going to get through it together. And when we take a step that there is difficulty in people's daily lives, understand that it's to protect our fellow citizens. And we're going to do everything we can to make sure we manage this coronavirus outbreak in a responsible way that protects our citizens. So this afternoon's update is today we tested 20 cases. Again, those aren't kits or tests because there are multiple tests per individual. Of the 20 cases, 18 were negative and 2 were positive. Both of the positive cases are from Harrison County. They include a 60-year-old male and a 50-year-old female. That brings us in total in Kentucky to 8 positive cases, 5 in Harrison County, 2 in Fayette County, and 1 in Jefferson County. While I don't have the most up-to-date information, I did read today from a press conference from Lexington that individual is improving. There is links between all of the Harrison County individuals. Those links are slightly different, and we can't disclose them at the time, but it's important to note that they are all linked. Again, it's critical that we know that we will have more positive tests as we move forward, but that's to be expected. And that the preparations and the steps that we are taking are to make sure that we're protecting our citizens. Just look at the appropriateness of what Harrison County did when they canceled schools, when they started taking the steps that they were taking. It just shows that being prepared and taking the necessary steps to protect each other can do so much. I talked to Judge Barnett this afternoon. I know at this point he does not want to get calls from me, but I did tell him that they are responding in a very appropriate way, that they are doing everything they can. Just think about the fact that days ago they put an entire small newspaper in everybody's mailbox in the entire county, giving them the information they needed to go. I'm very proud of them. As a recap, steps taken here in the Commonwealth include the state of emergency. We are still under that. That gives us all the tools that we need, and we're even taking steps to order various supplies if they are needed under that state of emergency. We have activated what's called the Shock Center, which is on the health side, and the Emergency Management Center. We held a call today with all counties, all county judges, just to give them an update, but also on that emergency management network so that it is up and running and that we are prepared. We've initiated changes to Medicaid, including eliminating prior authorization and any type of fees associated with testing or treatment for the coronavirus. I filed an executive order to waive copays and other costs related to private insurers that we have any control over. We have guidance on our website for everyone, and particularly counties that have positive cases. We have our coronavirus hotline up. That is 1-800-722-5725. 1-800-722-5725. We have put out a when to seek care, I believe it's called an infographic, that talks about if you are well but nervous, call the hotline. Don't go to your healthcare facilities. If you are sick but would otherwise not seek medical attention, think if you believe it's cough, allergies, or the rest, don't go to your healthcare facilities, call the hotline. But if you are sick and or you have an injury, then make sure you get the attention you need. I think I shared my own story about my son this last weekend. Make sure that people who need medical attention get medical attention. We have published the CDC guidelines with warnings. I want to go over once again, the CDC is recommending that individuals over 60 do not go places where there are large crowds. The CDC is also recommending that individuals that have heart, lung, or kidney disease, or compromised immune systems. Do not go to big crowds. And for both people over 60 and who fall in that vulnerable population, I'm suggesting you don't fly. I believe the CDC has put out warnings on that. Whatever you do, do not get on a cruise ship. Anybody who has those plans that falls into either of those populations, I would strongly recommend canceling them. Additionally, we have provided strong guidance advising nursing homes and long-term care facilities to restrict visitors. And we've already gotten some calls about people that are worried about seeing their loved ones. Once again, I understand. I know how hard that can be. You want to make sure they're getting good care. You want to make sure they're taken care of. They are people you love. But this is about their life, their health, and their safety. And it is my job to do everything I can to prevent what happened in Seattle from happening here. I want to make sure that our families get to spend the next number of years with those loved ones, and that we don't make a mistake and somebody who is infected is able to go into one of those facilities. We've asked businesses to prepare telework options and adopt paid sick leave. Well, I haven't seen the full breakdown. I know Walmart today announced some sick leave. I do believe that that is the right move. I'd like everybody's sick leave to cover periods where people are concerned. In those couple days, you want them to stay home while they're being tested and while that test is being turned around, as well as any longer period that they need to make sure that they are no longer symptomatic and that they are over it. And everything we know about the coronavirus is you do get over it and you are just fine afterwards when it's all said and done to come back to work and to do anything else. Today we took a couple more steps, as you all know, including our executive order, which allows pharmacists to refill prescriptions for up to 30 days. And if we need to stage pharmacies outside the regular pharmacy, then we'll be able to do that too. So Kentuckians should have confidence that we are working every single day, that just because we had a couple more positive tests today did not mean that they weren't expected, and that we will see more of this as we go forward. But I believe that our Department of Public Health, Dr. Stack, Secretary Freelander, all of our public health groups, all the organizations you saw up today are doing everything they can to plan. We will be having another briefing at 9 a.m. tomorrow, where we will be able to provide more steps we're taking as we move forward. And I think it's fair and reasonable to assume that we will be taking new and different steps, most likely every day as we learn more about this. So I hope Kentuckians can have dinner with their families tonight, put their kids to bed, understanding that we are working very, very hard on this, and that the most important thing is to continue to remain calm. Questions?
Paid sick leave. Morgan McGarvey filed that bill SB 282, but it only requires employers to grant employees up to 3 days per calendar year of paid sick leave. How does that help combat the spread or contain the spread? And do you believe that goes far enough?
Well, admittedly, I haven't read that legislation. I've been working on our response to the coronavirus full time, with the exception of being able to do the signing today for the Bowling Green Veterans Center and see a few school groups. This is my focus where it should be. We do need enough sick leave to ensure that people, especially who are infected, can be at home for long enough to get over the virus, and we don't want to create a disincentive, especially to those that are barely scraping by, to come back to work.
So would you recommend that legislation cover that 14-day quarantine period?
Well, what I'm recommending right now is that it is in the economic interest of every business out there to provide enough sick leave to make sure that those that have the coronavirus or who are feared to have it can be at home, can stay home long enough to get tested, and if they test positive, to continue to stay home until they are over the disease. Just think about a manufacturing facility. It's the difference between potentially paying 1 or 2 people that sick leave or potentially having to shut down the facility for up to that 2 weeks.
Can we get the ages and genders
Yep.
of the people again?
60-year-old male, 50-year-old female.
Okay. 50, not 58?
50.
Okay. And then are they in hospitals or in isolation?
It's what? Okay, it is 54 years old for the female.
Just figured double check.
Yes, thank you.
And then are they in a hospital or in isolation?
Both of them are in isolation. I believe they are in home isolation, but they are receiving treatment, and we are very comfortable with where they are.
Do we have a breakdown on how many people are hospitalized versus in home treatment?
We can get that for you. We'll have that tomorrow morning. Anybody that is in home isolation means that their condition is not so serious to where that home isolation with the right type of treatment works. And in those situations where home isolation is appropriate, it can be the preferred alternative as long as that person gets the individual care that they need.
Yeah, in terms of your recommendation to the nursing homes and the long-term care facilities today, there were two words there that didn't necessarily have definitions. One of those was people who are in end-of-life stage, and then the other was loved ones. Are there kind of finer point definitions to that, or are you keeping that loose to
We can keep working on that in the guidance. I mean, we're working fast here.
Yeah,
As
I
we.
guess I was just wondering, like, is there a specific thing in mind for end-of-life?
Well, at end of life, we just want to make sure that everybody can see their relatives, have an opportunity to say goodbye. Too many of us have lost people we love without that chance, and we want to make sure everything we do, we include compassion along with the guidance that we're giving. And the reality of that situation is a potential infection of that person is just not the same with what's being faced.
Governor, the hotspot seems to be Harrison County with 5 people. It says there's a link between all 5 of those people.
There are links.
There are links. I mean, if it was a link like location, wouldn't it be better to tell the public? So people wouldn't think they'd be able
We're
to-
continuing to work on that. It is not a singular link. So we can connect all 5 people and how they come into contact.
It doesn't necessarily mean they're all family members.
No, it does not. It does not. And again, our epidemiologists are working and continue to work on that. We'll provide those details when we can.
Governor, you may have seen that Berea College closed for the rest of the semester. Is that an overreaction, perhaps?
We've got to give space for every institution, business, or other entity to make what they believe is the best decision based on the information we have at the moment. The administration is not currently recommending that universities or colleges shut down. Whatever they can do through the internet, through teleclasses, we suggest that they strongly consider that and look at its feasibility. But again, we want to give everybody the space to make the best decisions for them. Harrison County canceled their schools when we had, I believe, 2 cases at the time. That was obviously the right decision with what we now see as 5. So we're going to give the best guidance we can, give the best information we can, and then give room and certainly not criticize those who make decisions like Berea did today. Chris?
Governor, when we go back to Harrison County, have you figured out how the first person to come down with it got it? I know there had been mentions that there was no travel involved there. Did they come in contact with somebody? Have you figured that out?
Well, we're still working on that, but as we now believe this is community spread, it's going to be harder and harder to find what we might call patient zero. That as we see this spread across the country, and as we will see it spread across Kentucky, I believe that will be more and more difficult. And again, we're going to learn more as the commercial labs come online and as we can test significantly more people. We also want to make sure that any information we're giving is responsible and is in context. And so we're still working on traces, certainly in Harrison County. But while they are faced with 5 cases at the moment, they have some wonderful people that are doing the right things to help protect their people in that community.
Governor, the governor of Ohio is recommending that sports facilities not let fans watch sporting events. Any thoughts about that? Is that too?
Again, we want to give everybody the space, including other governors. I know Mike DeWine, to make the recommendations that they believe are right at that moment. Where I am is that any event that we are having, we should make sure that the CDC guidance for individuals over 60 or who are vulnerable for this particular coronavirus are encouraged not to come. I believe that people are having an event where they believe a significant portion of who is coming would fall in that area, they ought to consider it and consider it significantly. As we learn more, our recommendations will evolve, but we're currently not making that same recommendation here.
Doctor, I have a question that maybe is best for you to answer. and-
This is our Secretary Freelander.
Yeah.
I'm sorry.
Yeah.
Sir,
I did wear my doctor tie for you, so.
Well, I do appreciate that. When we hear about these people who have self-isolated as they wait to find out how their tests are going to return, what is a time frame that we can start hearing about some of these people falling off the list, having been negative, or finding that there may be a large number of positive tests? I'm just trying to figure out what that timeline is, because if we see a spike, is it these people who are in isolation, or are they new people, or are we going to get good news that these people are falling off the
Right.
isolation list and aren't positive?
So actually, there's a lot of good news from that perspective. We probably monitored around and had folks in self-isolation, around a couple of hundred folks. Most of those have fallen off. So almost everyone that has done that self-isolation, a vast majority, are now not in self-isolation. They are through that period. So that's what will happen with these folks. As we get out to about 14 days, particularly those that are the ones that are positive, we'll test them. They'll need about a 24-hour, 2 tests of being negative before they'll be released. And that's the way we determine that.
And if I can, having 18 tests come back negative today, it won't be every day. But these are folks that qualify for tests under guidelines where there is significant worry that they might have it. But remember that we also believe that many people are asymptomatic that may have the coronavirus, so there is so much that we don't know. And any given day, our statistics, whether it's people in isolation or the testing or the rest, those statistics may not matter the next day when we learn that much more. So again, we're trying to be fluid. We're trying to make the best decisions we can with the information we have.
Governor, a lot of 60-year-olds go to church or the grocery store. They could be considered large gatherings. Are you suggesting they should not go to those places?
Well, we may have more guidance on churches or other gatherings later in the week. I will say with regards to the grocery store, I would recommend that our 60-plus-year-olds, or especially those most vulnerable, go in off hours or use the click list. If you're a Kroger shopper, find those opportunities that you can to limit your exposure to crowds. You can't stop your life entirely, but if you've got a family member in town, if you can give them their list, go to. What we've learned is that especially for younger folks in good health, that the risk here is not very high for them. So let's help each other out too. If there's that, especially the senior who needs groceries, let's go for them. Let's know where we have low risk, and let's step up and do that work to help the people that need our help. Remember, homebound seniors still need our help. We cannot lose our compassion through all of this. Now, you should be prepared. You should use great hygiene, especially when helping that homebound senior. But if we allow fear to overtake us and we stop providing those services, we stop helping out other people, that's when more people are harmed than this virus will ever harm.
I got an email today from an allergist, and it said that if you've had a fever in the last 2 weeks, skip your shots. Are y'all hearing more non-essential medical practices recommending that?
We'd have to check that out. We don't have that information at the time, and I also don't know how allergy shots react with fevers generally.
Are you confident that Kentucky has the amount of tests it needs to get through this?
We have the amount of tests that right now under the guidelines that they would suggest we need, but I think we all want a lot more tests. I mean, we all want to get to a point where anybody whose doctor thinks that they even might need a test can get that test. I mean, we still have a significant reserve, but we want to get to the point where thousands of tests are possible. And remember, though, just because someone tests negative doesn't mean that their symptoms haven't manifested and that they couldn't still have it. But we all want to get to the point where there's more testing.
We had a viewer ask today, how long does it take?
You got a cough in here and not in here.
We had a viewer ask today, how long does it usually take to recover from the novel coronavirus?
So right now, we believe it's about 14 days, and that's the amount of time.
The actual answer is it depends. It depends on the severity. It depends on, I mean, there are lots of factors that go into the length of time that it would normally take. Some with mild symptoms, some may be asymptomatic. So it really just depends on the individual and their symptoms.
And what they do, which we mentioned earlier, is you want 2 negative tests that come after you've tested positive over the 24-hour period.
Of the 18 people that tested negative today, are you all waiting for any more test results, or just those 20, that was it for today?
Those are all the results that we will have today. We don't learn until about noon on any given day how many tests we'll have that day. These are the most tests we've done in any single day.
Are you all going to release any information about tests done in any other counties? Because right now it's just, the 3.
We haven't been releasing the negative tests in counties, given that they're negative. We don't believe that information is helpful, and just to suggest that someone thought they needed a test that turned out to be negative, we think could be taken out of context in a negative way.
One question I have, we did this story yesterday. There are people rushing to the stores to buy certain supplies. Do you have any advice for people? Is this, should they be doing that? Should they not?
Well, for our seniors that may need to stay home a little more, that's where we ought to make sure that we have the supplies. Those are who we ought to be stocking up on any supplies for. If you're in your 20s or 30s or in good health in your 40s and 50s, don't be doing that. Make sure that we have the amount of supplies that are needed for those that are the most vulnerable. If you suffer from heart, kidney, or lung disease, then we might want to make sure that you have a 2-week supply. But again, your loved ones can always go out and get what you need. I also have the ability, if necessary, to call up the National Guard. And we've ordered some meals, if the necessity comes to that, to make sure that we're prepared. My goal is we're not going to let anybody go hungry. We're going to make sure that we are there. And in addressing this situation, we're going to use every tool that this state has. All right. Well, we will see you at 9 a.m. tomorrow. Thank you all very much.
You getting tired of seeing us?